Okay, this is the presentation on the skin, part 2. So as we looked at, there are a number of different disorders of the skin. We can't go through all of them, but we'll deal with some of the most common ones. So the first category are skin reactions that are related to allergies or to our immune system. So for example, if we ingest or if we have an allergen or something that our immune system reacts to that becomes systemic, then this will cause the release of histamine, and this will cause a systemic reaction that we call urticaria or hives. And hives are caused when histamine is released. It causes the blood vessels to dilate and become leaky, and plasma leaks out of the blood vessels into the surrounding tissue, and it creates these raised lesions that are called wheals. And wheals can either be, as you can see in one picture, they can be lighter than the surrounding tissue, or they can be redder than the surrounding tissue. And of course, one of the main symptoms of hives is itchiness that occurs. So because this is a systemic reaction, that we need to have a drug that acts systemically to treat hives. So these are antihistamines that counteract the action of histamine, and we need to take them orally or some way that they get into our bloodstream, a systemic treatment. Contact dermatitis is also a reaction of the immune system to an allergen, but in this case it's caused by direct contact. So if the skin contacts an irritant such as certain soaps, for example, cosmetics, chemicals, latex, paint, plants, jewelry, adhesive, these are all things that commonly cause an allergic reaction in some people. Again, this triggers the local release of histamine, and it causes an immune reaction in the skin, and it causes itching. So contact dermatitis, because it's usually a local reaction just in the place where their contact with the allergen occurred, then sometimes just topical antihistamines can work. If not, then taking something orally so that it enters the entire system, a systemic response might work. So here are some common allergies. So this top one here, this is a reaction to soap. So this is a soap allergy. This bottom right one here is an adhesive to a Band-Aid. So wherever the Band-Aid adhesive was, we can see that reaction in the skin. And this one here is poison ivy, so on the bottom left. And poison ivy, the reaction to poison ivy is an allergic reaction. Not everybody has a reaction to poison ivy, although it turns out that about 90% of humans have an allergy of some sort to poison ivy. There's about 10% of us that do not react to that particular protein that's in the oil in poison ivy. The oil in poison ivy, just by the way, this is maybe a dating fun fact, but it can last a long period of time. So you can have it on clothes, and if the clothes aren't washed, if the oil still remains there, then coming in contact with those clothes can cause a reaction, even if you haven't, touched the plant itself. I think the oldest known sample of poison ivy oil that they came across was on a pair of boots that was about 200 years old and was still able to elicit that reaction. Atopic dermatitis is otherwise known as eczema, and again, this is related to the immune system. We don't really understand what the underlying cause of eczema is. We know that it is common in children, especially around the wrists, the ankles, the elbows, the knees, and we do know that there's a strong genetic component to eczema. So usually eczema, asthma, and allergies, that sort of triad of disorders runs in families, and so different family members may have a different combination of those disorders. So somebody may have asthma, somebody else with allergies, maybe somebody has eczema and asthma, but they tend to, all three of them tend to run together and within families. So we do think that there's some sort of genetic basis for eczema. It causes a kind of a leathery skin lesions, itching, redness, sometimes swelling or blistering, and flare-ups. So there may be periods of times where there's no outbreak on the skin, and then flare-ups are often triggered by things like stress, sometimes humidity in some people, sometimes changes in temperature. So things that reduce inflammation will help with eczema. So usually topical steroids, like things like cortisone cream, are used to help deal with the flare-ups. A big category of skin disorders are infections. So we have this tough outer layer of our skin, but if viruses or bacteria or fungus invade underneath that layer of skin and they're not taken care of, they can create an infection. So an example of a viral infection of the skin that is fairly common is herpes. Now, herpes is a whole family of viruses that includes viruses such as herpes simplex 1, which is the virus that causes cold sores, which are these small fluid-filled blisters often around the nose and mouth area. Also a different variant is simplex 2, which is the type of herpes that causes genital herpes. It's spread by direct contact. Herpes varicella zoster is the type of herpes that, the strain of herpes that causes chicken pox, and therefore also shingles, and that's what we see in this bottom diagram here. So all of these viruses, once they infect a person, they never leave. And so it remains dormant in nerve endings, so it won't create any blisters unless it is activated, and then the blisters will then return. And so this is why people have herpes outbreaks where they'll get cold sores and then they'll go away and then they'll come back again, and so on and so on. So things that can trigger the virus to become active are things like if we have a decrease in our immunity, so if we're stressed, if we get sick, sometimes exposure to sunlight, UV radiation will activate that virus and it will come out. The chickenpox shingles cycle is interesting. So herpes varicella zoster is the herpes variant that causes chickenpox. Once the chickenpox symptoms have gone, the virus will remain inactive in nerve endings, and it can become reactivating, causing shingles. And these are very painful lesions that usually follow the course of a spinal nerve, so exiting the spinal column and then heading down toward wherever it's going in the body. There is a vaccine for shingles. It cuts the risk of illness by about half for adults in their 60s, but when they reach ages 70 to 79, the effectiveness falls to about 41%, and by the time they are about 80 years, then the effectiveness is less than 20%, which is too bad because as people get older, they can get much sicker from shingles. So this top one, this is a cold sore, herpes simplex 1, and this bottom is shingles. Another example of a viral infection of the skin is human papillomavirus, or HPV. When it invades the skin, it usually invades those outer dead cells that contain keratin, and it causes those cells to get larger, or hypertrophy, and it creates this little mountain of enlarged cells, and that's what we call a wart. And there are many different types of warts: common warts, flat warts, plantar's warts, genital warts. So here on the left, these are flat warts, and here on the right, these are plantar warts that we usually pick up in change rooms and places like that. That's because viruses thrive in kind of moist environments. Warts themselves are not life-threatening, so they may not need to be treated. When they're on the bottom of the foot, they can be painful because they can push into nerve endings, and so it can cause pain when walking and things like that. So either for cosmetic reasons or because of painful reasons, people may want to remove the warts, and there's a variety of techniques. You can go to your family physician, and the most common method is that they take liquid nitrogen and they drop it on the wart, and it freezes the skin there and kills the wart. You can also go to pharmacy, and you can pick up wart removal kits. These are usually salicylic acid, and you drop the acid on the skin, and it gradually kills the skin and the tissue and the virus underneath. A really simple method is actually duct tape. So if you put duct tape over top of the wart, and it needs to stay on for a longer period of time, so maybe about 1 to 2 weeks, it will actually also kill the skin underneath and kill the wart. There are a variety of bacterial infections of the skin. Most of the time, if bacterial infections are either Staphylococcus or Streptococcus bacteria, and they enter through a break in the skin. And so as long as the skin is intact, they don't harm the skin, but if they enter in the break, so oftentimes bacterial infections start as a minor cut or a rash or an insect bite that somebody scratches, and it opens up the skin, and if there's bacteria on the hands, then it invades. One of the most common ones is impetigo, and if you work with kids at all, whether at school or at a summer camp, particularly camps where kids are not exactly most diligent in their personal hygiene, then sometimes we get outbreaks of this particular bacterial infection. So highly contagious by direct contact. So somebody has impetigo, they scratch, and then they touch somebody else, or they spread it to another part of their body. It causes these red sores on the face, hands, and feet, usually around on the face, the nose and mouth area. And the sores will burst, and they form these little rings with a yellow crust, a honey yellow colored crust, and that's pretty typical of impetigo. So this is treated by topical antibiotics and really good hygiene, making sure that kids wash their hands so that they're not spreading it to other parts of their face or body or to anybody else. Another bacterial infection that is important are pressure ulcers, and these start by a place where something is pushing up against the skin and it's restricting blood supply to that skin area. And just like all living cells, if blood is not getting to that area, no oxygen is getting to that area, and those skin cells will start to die. And as they die, then they get cracks in them, and bacteria can invade and cause an infection. So typically what happens is that there's a pressure point, and it could be if a person is lying down, it might be on their tailbone, that's a common place, or on the backs of their heels if they're lying on their back, or elbows. So anywhere where there's a pointy part of the body that may be pushing into the bed. Or if somebody is sitting in a wheelchair that's not fitting very properly, then around their hips or backs of the knees. So those are places to watch out for. Orthotics that don't fit properly. And so what we'll see is that the skin will become blanched at first, sort of whitened, and then it'll start to get very red and inflamed. And that's what we call stage 1. When the skin starts to break, then that is what we call stage 2. If the bacteria invade and we get an ulcer that extends right through the epidermis and the dermis down to the fatty layer, that is stage 3. And stage 4 is the worst layer, where the ulcer actually will extend right down to the muscle, or maybe even beyond the muscle to the bone. And a pressure ulcer, because it's a pit, it takes a long time to heal, and so the real trick with dealing with pressure ulcers is to prevent them from happening in the first place. So recognizing pressure points and trying to catch them at stage 1 or at stage 2. So this picture that you see down here, this is a stage 2 pressure ulcer. So you can see that the skin, there's some bruising, it's inflamed, and you can start to see the skin break down right here. So if it's not caught at this point, it can become very serious and very difficult to treat. Fungus can affect the skin as well. So there's a couple different common fungal infections. One of them is tinea. Tinea is the trichophyton fungus, and all fungus thrive in very hot, humid conditions, and usually a fungal infection causes itching, sometimes cracking, weeping of the skin. So some common ones that you may have heard of, this top picture, this is Tinea corporis, which is ringworm, and this is Tinea pedis, or athlete's foot. Those are both examples of fungal infections. Dandruff is also a fungal infection, by the way, and it can be caused by a number of things, including dry skin, sensitivity to different hair products, and or overgrowth of fungus as well. The second very common type of fungal infection is Candidiasis, and this is the fungus that causes yeast infections, so things like thrush, which is what we see here, this overgrowth of fungus inside the mouth. Diaper rash is a fungal infection, as are vaginal yeast infections. This is just a normal flora that overgrows. And so we normally have this fungus, but when it takes over and grows, then we call it an infection. So treatment for fungal infections, we have antifungal medications, and they can usually be treated with a topical antifungal medication. Very rarely would you need an oral antifungal, and of course keeping that area clean and dry. So with athlete's foot, keeping your feet clean, keeping them dry, changing your socks, all of those types of things will help the fungus from growing. There's a whole raft of diseases, skin diseases and disorders that we have no idea what their cause is. One of the most common ones is psoriasis, and we know that psoriasis is excessive cell division of the skin, and so you get this kind of overgrowth of skin, and it causes these raised red scaly plaques that appear on hands, on feet, on scalp. There's a partly hereditary component to psoriasis, but again, we don't totally know that, what the other parts of the cause are. Outbreaks are often triggered by stress, infection, hormonal changes, skin trauma, those types of things. Treatment for psoriasis could be anything from topical steroids to reduce inflammation. UV light therapy has been effective, and medications that contain coal tar may also be effective. Okay, this is the end of part 2, and there'll be one more part, part 3.